This video is for the purpose of the assignment Defensive Medicine. What is defensive medicine? Give some examples. As defined by Dr. Richard Anderson, medical doctor and chairman and CEO of the Doctors Company, the nation's largest physician-owned medical malpractice insurer, gives the definition of a test or procedure or therapy that's ordered by the physician primarily to protect himself or herself from liability rather than because of its diagnostic or therapeutic utility. So some examples of defensive medicine are the patient comes in with signs and symptoms that present, which lead the doctor to believe that a sprain occurred. The doctor doesn't need the extra test to know that a sprain occurred. However, he knows that he could be sued if there are more problems. So, in order to rule out those more problems, even though he believes it's just a simple sprain, and what the patient says happened shows him that it's just a simple sprain, he orders an X-ray. And that's defensive medicine. He's protecting himself from claims that maybe there was more. He's showing this is the proof, even though he already knows. Another example would be for chest pain is a common one. They come in with chest pain, atypical, and the physician is going to order a large amount of tests. This is because the patient could go home, and even though when he was seen, he didn't have a heart attack, he could go home and have a heart attack. So the physician has to prove that he or she is not having a heart attack right then. So all these tests aren't going to change the treatment. They're not going to help the patient. It's for physician liability. How have healthcare providers and insurers worked to prevent the practice of defensive medicine? According to Richard Anderson, the most common way is through tort reform, mediation, and arbitration. He does not believe this is the best way, but it is what is normally goes on. What are some other more beneficial practices healthcare providers have adopted as effective ways of reducing the incidence of malpractice suits? There was a study done in California, which has the lowest cost malpractice insurance, according to Dr. Richard Anderson. And it's called MICRA, is this organization. And they have 4 major ways to reduce this. One is a $250,000 cap on non-economic damages. And he explains that this is good because you can't put a price on, let's say, pain and suffering. How does the jury know this person needs more monetary compensation because of their pain and suffering, or this person needs less? You can't really figure it out. It has to do with feelings. How do you feel about what happened? And these feelings ought not to be considered, according to Dr. Richard Anderson, when determining this. So basically, across the board, if you have determined that a medical malpractice did happen and you are deserving of damages, your non-monetary damages have a cap, $250,000. Everybody gets it. So he also includes on this portion that there is no cap on total damages. So if it costed you and you prove it, then you do get that monetary compensation. So the cap is just for non-economic damages. Number 2 way is periodic payments for lifetime payments. Basically, if you get a sum of money to assist you with claim that has to do with your lifetime, and it will affect you for the rest of your life, you're going to have the insurance company be able to give periodic payments, let's say monthly, so that you can be paid for your lifetime instead of giving you it all up front, which could, in essence, break a medical malpractice insurer. It could make them go bankrupt. So they're able to pay it in portions. The third is collateral source, which means no double dipping. If your insurance pays out, you can't go back and file another claim and get a double payout. Number 4 is a limit on attorney contingency fees. Okay. Some interesting things I found. Dr. Richard Anderson quoted, "If it is the right test, it isn't defensive medicine." And I believe that to be true. If doctors are ordering the test because they want to be sure, and they're not sure, they're ordering it for diagnostic criteria to make sure their patient is suffering from the thing that they think that is, to confirm, then it's not defensive medicine. It's good practice. Another quote he gave was, "Medical standards of care have been polluted by the legal standards of care in the U.S." And I think this is true, because if we're regarding life and we're looking at medical ethics and the medical standards, our definitions of and regulations and all these things would change, but it's often polluted by the medical legal standard of care, which protects for compensation. It changes everything. So if he thought that if you're going to do reform, you have to look at the medical standards of care, and you have to separate them. That's what he thought was the best reform. I would agree in part. I don't know if that's the best reform, but that is a good reform, because it would help also to remove the feelings, like the jurors and the judges, how they feel about what happened to the patient sometimes sways their judgment. Oh, this bad thing happened, so they feel bad and they want to give them something. It takes that away. He quoted the economic cost of defensive medicine from 55 to 300 billion, but he said it was likely more than 300 billion. However, what you could prove on paper was somewhere in the 300 billion. He said virtually all medicine is defensive medicine, and that it is actually incalculable. I don't know if I agree with that, but that is what he said. I found another video. It's cited in the attached document, where they were quoted saying that physicians need to become better communicators to their patients and talk about the subject at hand. And that this communication, they did a study about it involving patients who were sued and doctors who were sued by the patients. And they found that 2/3 of all the people studied, including physicians and patients who have sued or been sued, said that better communication could reduce litigation. And I believe that to be true. If you give the patient the option, you say, "Hey man, I really believe it this. I could give it a 99% certainty. But hey, just in case, because this legal liability exists, we could do an x-ray to confirm. Or you can trust my opinion." I think if these things were talked about, there would be less litigation. So I believe that would be the best way. This concludes my video for defensive medicine. Thank you.